Welcome to Dental XP. I'm Tomohiro Ishikawa. Today, I'd like to show you a simultaneous GBL procedure with collagen membrane and titanium mesh. This patient lost 5 maxillary teeth in a traffic accident. Prior to orthodontic treatment, 3 implants were planned to be placed in the number 4, 5, and 6 positions. A CT examination showed a large bone defect which limited the possibility of an optimal aesthetic result. Now, I'll show you a video documenting this procedure. A horizontal incision should be made in the slightly buccal crestal zone. Vertical incision should be placed at least 1 tooth away from the augmentation area. Using a trapezoid flap is important to increase blood supply and achieve primary closure. After careful reflection of the flaps with a back action chisel, a releasing incision connecting the medial and distal vertical incisions is made. After that, we can estimate the size of the final augmentation. Autogenous blood could then be collected and mixed with bone graft materials. Titanium mesh is cut and molded into the appropriate shape. Slits cut along the side of the mesh allow it to be shaped and adapted to the anterior edge. Autogenous bone is harvested with a bone scraper and mixed with bias. Implants were placed in their ideal positions. I used a small carbide burr for decortication. We needed vertical support to establish the ideal interproximal height of bone. A temporary heating abutment is used as a vertical support. Titanium mesh was shaped to fit the augmented area more precisely. Mixing autogenous blood with bias and autogenous bone makes it much easier to position and work with. Care must be taken that bone graft fills all the space under the titanium mesh. Cross-linked collagen membranes were then used as a barrier. We recheck the volume of the release incision to ensure that we have at least a 3 mm overlap of the buccal and palatal flaps. Horizontal mallet sutures are used to take the tension off of the flaps, and interrupted simple sutures are used to close. In these different views of the reconstructed area, you can see the results of using the titanium frame and cross-linked collagen membrane. Looking at the X-ray slides, you can see how the 3 mm temporary healing abutment is supporting the titanium mesh well above the implants. Thank you for listening.